Can you first describe your symptoms before the surgery? What did you notice? What were your main symptoms?
Well, it was starting down my leg.
Yeah, leg pain.
Yeah, it'd go halfway and then it started going further and then the
Pain,
back.
mostly pain.
Pain, yeah.
1 to 10, how bad was that pain?
Oh, that was like a 9, 10.
9, 10.
Yeah.
And as well, you had back pain. How bad was the back pain?
Just about the same.
Same.
Yeah.
And this has been going on not for just a few weeks and so on. How long did it was going on?
Oh, jeez, I think
4 years.
4 or 5 years.
longer
Even
than that.
longer.
Probably 7 years. or
7
more.
years. And how was your life in that 7 years? What could you do and what could you not do?
Well, I had to quit my job.
Yes.
'Cause I couldn't do it. And
Yeah.
Stuff.
And that sort of affect the entire life, entire work, and entire family's life.
Oh, yeah.
So what did you notice during that time, how she was doing and what could she or what could she not do?
The things she liked to do is she always mowed lawn and everything, and then she just less and less.
Yeah. She practically stopped participating in
Yeah.
basic daily life.
Oh, yeah.
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 Now we put you through our protocol. We noticed that you have a bad disc, and I'm going to turn here. We noticed that here at this level, 5, 4, 3, 3, 4, bone was on bone. And we did that minimal invasive spinal fusion, the OLLIF procedure. And that surgery was about 5 weeks ago, correct?
Right. Yeah.
So, do you remember the surgery?
Yeah.
Okay.
Yeah.
How long did you stay in the hospital?
Just overnight.
Just over the night.
Yeah.
And let's say the leg pain that was 9 and 10. When did that leg pain go away?
Oh, immediately.
Immediately, right
Yeah.
after the surgery.
Yeah.
Okay. And how is that leg pain now?
It's pretty much gone.
Yeah. And what about the back pain? How long? Back pain usually, obviously, if you look at there, we put big screws in. Sometimes that take longer to go away. How bad is your back pain?
It's not too bad now with the screws and
Yeah.
stuff.
So your back got used to it.
Oh, yeah. Yeah.
So how's your daily activity now?
Well, I'm restricted yet.
Yes,
so-
yes. We put you on a restriction for good reason.
Yeah.
Overall, how do you feel? Are you ready to do your basic daily activity?
Oh, yeah.
Excellent.
Yeah.
And what do you notice comparing her maybe about a month before the surgery and now we are about a month after the surgery? What do you notice?
She's much easier to get along with.
And you see, that is actually nothing unusual what I hear, that, pain is not only painful to people who have it, pain changes people.
Yeah.
And lots of families break down on problems like that. So even though we are humorous about that, it is a serious thing. If you cannot participate, what I say, the pain, people who have pain are not only painful to themselves, they are as well, the pain as well affect and is painful to everybody who's
Oh, yeah. 'Cause
surrounding you.
can't
Yeah.
Go out and do things.
Yeah,
And
and
stuff.
more than that, people are just more irritated if they're in pain.
Yeah.
So you have a point, okay? Now, overall, it went years. If you have similar symptoms, would you wait again years to go through this process?
Oh, no.
So, because
It's-
these are many years that you're losing on your life,
Yeah.
and your family is as well affected.
Yeah.
As well, another thing that I explain to everybody, for us to do this surgery, we are relying on restoring your anatomy, which we call the so-called anatomical or physiological decompression. Many of my colleagues, they say the only way to achieve the taking pressure off the nerve is literally flaying you open and cutting lots of bone, which would be the open old-fashioned surgery, many hours, lots of blood loss, definitely much longer hospital stay. But people who have gone through that, they know those patients, they don't feel like you just a few weeks after the surgery.
Right.
It takes much longer for them to recover.
Right.
So, any comment, anything else you want to know or ask or say? No?
Wish they could have done it to you when you had to have back surgery.
Oh, you had the back surgery.
Yeah.
Tell me about your back surgery. When was it?
90, no, 2000.
2000. Okay, did you get a fusion as well? And I'm assuming you got an open old-fashioned fusion. Do you remember that surgery?
Oh, yeah.
How long did you stay in the hospital?
4 days.
And that's the same today. That surgery, still people stay in the hospital somewhere between 3 and 5 days. How long after the surgery? Do you remember how long was the surgery? Were you there?
Oh, it was long,
Yeah.
surgery, because I was a little worried.
Yeah, you
They
were
said
so
like 4 hours
four-
or 5,
yeah,
but
4
it
5
was
hours.
like 6 or so.
yeah, 6 hours.
Yeah.
How many levels did they do?
L4 and L5.
The same, almost one level.
Yeah.
So I'm going to turn around.
Oh, that's one too.
Yeah, okay. Well, your surgery, actually, my part was only 20, skin to skin was 27 minutes. And our fluoro time, which is the amount of the radiation we use, is just about the 130, about 2 minutes, which is nothing. And as well, our blood loss was about 2 ounces, which is, as well, for this kind of surgery, very little. How long after the surgery, how long did it take for you to recover? And if you compare your surgery to her surgery, what are the differences?
A lot.
A lot.
Yeah,
So-
they have a,
Full.
Full body gas.
yeah.
No, how long did it take you to be able to do basic stuff and so on? You remember that?
8 weeks.
8 weeks. Yeah.
8 weeks, and that was just to be able to get around.
Just to be able to get around.
It
Whereas
was like 6 months.
6
months
months
before.
to recover.
Yeah.
So, comparing you, when you were 6 months before the surgery, do you think she's there yet or not yet?
Oh,
She's already there. So in 5 weeks, we achieved the result of 6 months.
Mhm.
And that is the true difference between these two surgery. Within weeks, you are where, after open surgery, people are within now 5, 6 months.
Yeah. Oh,
Okay.
yeah.
Well, and you're an example for that. Well, that was extremely helpful. Thank you so much. I appreciate that. Okay.